My guest this week has become one of the most familiar faces through the pandemic and through the coverage of it on the media. She is the Professor of Global Health at Edinburgh University. She's an American, but she has moved to Scotland with her family. Professor Devi Sridhar, welcome.
Thanks for having me.
Do you understand why, even though we have spent an absolute fortune on test and trace and all the systems around this, we haven't been able to make it work as well as some other countries?
Well, I'm going to be blunt in my usual style and think it's because I think we have a government that's prioritized making money for private companies and trying to kind of get the most out of the public system for enrichment rather than actually working for the public good. It doesn't make sense in the UK that we have one of the worst economic prognosis among the G20, that we have one of the highest per capita death rates for COVID. A lot of NHS services have also been paused, leading to excess mortality in other areas. And we've spent the most on the COVID response. It just doesn't add up. And if you start to look at the contracts for PPE, for test and trace, I mean, they didn't really go down the route of the interests of public health. They went down the interests of how do you make enough money from this crisis.
If we'd have locked down earlier, how many lives could we have saved?
Actually, if we had locked down already in late February, we probably could have saved 80 to 90% of the people who died. And I think the bulk of the deaths were preventable.
Well, it's just, it's been such a tough year for so many people.
It's been such a tough year for so many people.